Good quality of life has to be defined for each individual patient. Every person is different. But I think that we have to understand who the patient is, what are the patient's expectations of life, vis-a-vis their family, their relations, and understand how the seizure disorder is interfering with these issues. And we can try to see how can the treatment of the seizure disorder overcome some of the obstacles that are interfering with their ability to reach those goals.
I think he knows that there are positive outcomes that are available to people. And I think he's got an inner core that wants to fight for every patient to make things better for them, because I don't see him as being someone who would ever give up.
Yes, quality of life is very important to Dr. Kanner. There are many times I could get discouraged and just say, well, I'm going to accept my condition for the way it is, and I'm going to have seizures. However, he said his goal is to get me to a point where I don't have any seizures.
Well, Erica saw Dr. Kanner from about the time when she was 7 until just a few years ago. Erica's probably one of Dr. Kanner's success stories. I wonder if he would say that. But he helped us through to the point where Erica was not having seizures anymore, and the unusual situation where she doesn't have to be on the epilepsy medication anymore.
I offer him congratulations on being an honoree through the Epilepsy Foundation of Greater Chicago, and that no one is more deserving for his care of patients, for his consultations to physicians in the area and throughout the United States, which come with the highest of expertise, and also to his tireless research, which has informed the world of many things which, prior to his examination of these areas in the field of behavioral neurology, pharmacology, and treatment of epilepsy, these things were not known if it were not for Dr. Kanner.
And there couldn't be a more fitting recipient than Dr. Kanner. He'll see somebody, he does not care if they have insurance, he doesn't care if they can pay. He just did surgery on a young woman that no one else would have ever dreamed to do surgery on. And she's seizure-free. She's 19 years old. And just, you know, it's just every day the stuff he does is just extraordinary. And he's world recognized.
And he's a world recognized for bringing the importance of the psychiatric comorbidity of epilepsy. He was a child psychiatrist early in his career and did that, and then went on to neurology and then epilepsy. So more than anyone else in the country, he has brought the importance of the psychiatric comorbidity, how we have to pay attention to it. He's really been able to bring it out of the closet, if you will, into the epilepsy clinics.
Also has been very active in the advocacy aspect of epilepsy. So not only does he treat patients, he also is involved in spreading the word, as it might properly be termed, through articles he's written, through videos that appear online, and through lectures.
Every time I went in to see him, somehow when I left I felt good. He just has a certain way about him that made me feel that he was with me every step of the way.
I mean, he called me back from a wedding once. We couldn't get our meds, and I called him on a Saturday. I had him paged on a Saturday afternoon, and he called me. You could tell there's a wedding going on in the background, you know? It's just like, most doctors don't do that. I've never run into that again.
You know, I'm a very lucky person. I enjoy every day I come to work. I enjoy, you know, working with my patients. And I tell my residents and fellows when we're making rounds, are we having fun, guys? Because if we're not having fun, then there's something wrong.